This meeting is a meeting of the Organization of Cancer Institute in Europe. We are now an organization of more than 100 cancer centers. And what is specific to OECI is that we are not a scientific organization. We are an organization of Cancer Institute, of comprehensive cancer center. We are in favor of comprehensiveness, which means pluridisciplinarity, interdisciplinarity, link between clinic and research. And this is a particularity of our cancer center. This Congress will be focused on mainly three priorities. The first priority is a core business of OECI is accreditation and designation. We are an organization that are able to accredit comprehensive cancer center and cancer center all over Europe. And this is very important because we think that we need a cancer center at least for each country of the European community. And in big country, we need a cancer center every 5 million inhabitants. And because all the patients will not go to the cancer center, we need also a network between cancer center and the other hospital. And we will talk during this Congress about new accreditation process for network of cancer center with other hospitals. The second priority of OECI is the relation with patients. It is very important to find a place, a role for patients in our hospital, for patients in our clinical trial. And it is of interest to point out that the priority of the patient are sometimes very different from the priority of the professional. What they want first is quality. They want to be sure that where they knock on the door is a good place. They also want to be sure that after the cancer, when they are cured, they will not have problem with their insurance, and they want a close relation between their GPs, their general practitioner, and their hospital. And that's very different from professionals who want, clinical trial, innovation, and a lot of different things. And in fact, what we have to do is to share the priority of patient with the priority of the professional. And the third priority of OECI now is outcome research, because you probably know that a lot of progress have been made by clinical trial, but clinical trial a selected group of patients. And we need now, in a group of 100 cancer centers, to look if these progress are translated in the real world when you don't select at all patients. That's called outcome research. And this is the third priority of OECI. We will also discuss during this meeting about the new tool of the Horizon 2020, after Horizon 2020, Horizon Europe, called a mission, a moonshot mission. And this is a big deal, this is a big ambition. And we think within OECI that we should unify the cancer family. And the cancer family means the cancer center and the patient family. Of course, we need also the industrial, we need the research people, we need everybody in this family. And what we think is that it could be really a very enthusiastic program for Europe, because we have a lot of criticism about Europe, but why not to put cancer at the top of the agenda and to try to put that in a way to unify the European people. And that was proposed by one of the candidates for the European Commission, Mr. Weber. And we were strongly supporter of this ambition, because we think that cancer is not from the left or from the right. Cancer is really something that can unify the European people. And this is maybe the major message of OECI. We are trying to unify patient and professional. We are trying to unify various forms of comprehensive cancer center, and we are trying to, of course, improve the results. And the results are improving. but we need to work very strongly to do better in the next future.
Sì, è la parola giusta, orgoglio per Bari, orgoglio per l'Istituto Oncologico, perché è stata riconosciuta, è stata valorizzata la crescita che l'Istituto ha avuto sia in termini di offerta assistenziale sia in termini di ricerca, e che ha portato OECI per la prima volta a individuare Bari come sede della convention annuale. In realtà abbiamo voluto cogliere l'occasione per consolidare i rapporti che abbiamo già avviato con i nostri colleghi russi di Mosca, del Blocking Hospital e dell'ospedale ZIN, e con i nostri colleghi di San Pietroburgo, e siamo riusciti a definire una carta dei principi che abbiamo sottoscritto qualche minuto fa e che rappresenta la comune base etica per la futura collaborazione.
Questo evento e la giornata di oggi, che segna l'inizio di 4 giorni di convegno, li possiamo considerare un punto di arrivo, certamente, di un grande lavoro che è iniziato 2 anni fa, quando a Brno proposi la candidatura dell'Oncologico di Bari come sede degli Oncology Days nel 2019, ma è anche un punto di partenza, perché se siamo arrivati sino qui, grazie a un lavoro di rete, in quanto abbiamo ricevuto il supporto di tutti i direttori scientifici degli IRCS italiani, del Ministero della Salute, di Alleanza contro il Cancro, bene, questo tipo di supporto è l'espressione di un lavoro di rete, perché ciascuno di noi, ciascun ricercatore, ciascun clinico è chiamato a essere, come abbiamo detto più volte, costruttore di ponti. Noi dobbiamo essere capaci non solo di far bene ciò che è il nostro lavoro, ma anche di metterci in relazione. E oggi questo rapporto, questo documento tra l'Italia e la Russia è l'espressione di questa capacità che l'Istituto comunque ha maturato in questi anni di entrare in relazione con altre realtà al fine di creare sinergie assistenziali, perché ciascuno di noi ha delle expertise particolari che è bene, per il bene del paziente, che vengano messe in rete, vengano condivise. E c'è un sinergismo anche scientifico. La mission degli RCCS è quella della ricerca traslazionale, ossia di quella ricerca che parte dal laboratorio e arriva al letto del paziente per poi tornare nuovamente in laboratorio. Bene, questo tipo di sinergismo oggi ha ragion d'essere solo nell'ambito di rapporti a livello nazionale ed internazionale, per cui davvero ben venga questa collaborazione, che sicuramente porterà dei frutti sia per noi sia anche per i colleghi russi, perché ciascuno di noi nella vita ha sempre bisogno di imparare, e tutto questo davvero si inserisce in maniera perfetta con quella che è la realtà della rete oncologica pugliese, che oggi è oramai una realtà di fatto della nostra regione, che rappresenta un'occasione unica per curare al meglio i nostri pazienti, e davvero sarà anche l'occasione per poter mostrare ai colleghi russi cosa in Puglia siamo stati capaci di fare.
Well, this is the first meeting for the last time which we take part as a cancer institute, and I'm very anxious about the future and hope that we will have a good cooperation in the future just to solve the problems which we have now for the treatment of cancer patients. Well, from the last year we have a special program in Russia. It's a program of development of oncology, and it's some special situation in Russia that we have programs one after the other. For example, several years ago it was started program to decrease the mortality from cardiac disease, and now we have a new program from the last year. And for us it means, for Russia, it's a lot of investments in the field of oncology, and I'm happy that we start this program and hope that in several years we will have a great success in Russia with these investments, and also with cooperation with European cancer institutes, because we really need help of them just to be as good as they are in many fields which we still need to improve.
So we had 3 days meeting organized by the Cancer Center in Bari, and they did a really good job. So the first day we had the interaction with Russia, the bilateral meeting. So it's a very different countries, but we are starting new collaboration in order to foster the equality in all Europe. The other 2 days were very interesting as well. The first was the OECI meeting on pathology and patient advisory. So the pathology is key for all the activity because you need to standardize all the assay analysis and the biobanking, all the diagnostics. So pathology is really key, and it's very important to equalize the activity in all of Europe. And also the patient information and advocacy. Patients should be aware of what is going on and should participate actively in all the process. And the last day there was the OECI, the Oncology days. We had very important talks about the innovation, all the new technologies they should put into the clinical practice, and the network that OECI is doing is very important. As myself, as president of Alleanza Against Cancer, which is the Italian network of comprehensive cancer centers, we're doing something that with a different scale that OECI is doing in Europe. So we want to bring all the cancer centers together to improve the standards and to exploit the experience and of each centers in order to synergize, to bring their own expertise on the clinical practice and research. And this is done in Europe with the OECI, and you know, this event in Bari is very important because the European coalition, the group of cancer centers, they are fostering all the activities, and this at the end they will provide a very good benefit for all the patients.
So the networking is important in oncology for the simple reason that how more ideas we have, as faster we can improve. And the point is collaborating. We have one big problem is that we have the egos of the doctors or the scientists who want to maintain and keep the information for themselves before it's published. The point is that, in fact, we should work together in front and publish together, because it's the bonus for society, the bonus for the patients. And the last thing we can say is that if we will find a solution, I'm not sure, we will find a complete solution, because if we look to the outcome of the last 10 years in breast cancer, colorectal cancer, prostate cancer, they remain flat panels. So patients come too late, or patients have perhaps not the good, let us say, immunological impact of outcome for the same disease, and that's a big problem. So we can try to bring together all the knowledge to improve it. Drugs, well, first of all, diagnosis with genes, proteomics, whatever you want. Surgery remain the main topic, certainly in solid tumors. We have then also radiation, and if we can bring them together in a certain sequence, perhaps we can fit the best for the patient. And if we cannot cure him, we should look to the quality of care for the patient, and not always to giving him drugs and drugs and drugs as we do. And I was impressed by a Danish study some years ago, I think 4 or 5 years ago, where stage 4 lung cancer was treated with the last treatments available versus best palliative care. And best palliative care was better in outcome than the treatments. So we should think about it.